Hello and welcome. I'm your host, Neil Howard, here on Health Professional Radio. Thank you so much for joining us for another segment. In this segment, we're going to be speaking with returning guest, Dr. Gregg Sylvester. He's joining us here from CSL Seqirus to talk about the CDC's Advisory Committee on Immunization Practices, or ACIP, vote around preferred flu vaccines for adults 65 years of age and older. Welcome back, Gregg. How have you been?
I've been very well. I'm Gregg Sylvester, and I do work for CSL Seqirus. I'm their Chief Health Officer. I run our Medical Affairs Department, and I'm a physician, is my educational background.
Well, tell us why the CDC Advisory Committee on Immunization Practices vote is so significant regarding flu vaccines.
Well, I think that I think you're absolutely right. I think it is significant. And I think the reason why is when the CDC and the Advisory Committee on Immunization Practice looked at the data, they said that the vast majority of people that actually have severe morbidity and then eventually mortality are those that are older. It's that 65 age and older, because our immune system has started to wane. We call that immunosenescence. And what they saw is that there were some vaccines that had the potential to actually offer greater benefit. Right now in the United States, there are 8 vaccines for influenza that are given on an annual basis, but they looked at 3 of them that they believe enhanced our immune system. And it took them quite a long time because of the COVID and because of the due diligence of looking at all the data that was available. And what their conclusion was that, for instance, in our case, the adjuvanted vaccine, our FLUAD, was deemed to be better than a standard influenza vaccine. And then they added 2 other ones to that category. And so they now have a preferred or preferential recommendation. For anybody that's 65 and older, they are recommending preferentially that either you get a adjuvanted vaccine or you get a higher dose vaccine. And I think this is very good public policy, and I think we'll see a reduction in morbidity and mortality when it comes to influenza in that older age group.
Does the dosage play any part when it comes to, as you say, enhancing our immune system as opposed to just protecting us from the flu?
Well, so that, there's 2 ways of delivering a flu vaccine, and one is a pre-filled syringe. You go in and you see that syringe, and it's only for you. And the other one is a vial where they put an empty syringe in. And so they don't take more out for adults that are 65 and over. They still only take out the prescribed amount. But within that amount, if it's coming out of a vial, there are 2 of the vaccines will actually have additional antigen in there, additional fighting power. And in our vaccine, they'll actually have an adjuvant that actually enhances our immune system. So the dose won't change, but the ingredients within it are more robust than a standard influenza vaccine.
Going into this year's flu season here in the Northern Hemisphere, explain how this recommendation is going to impact health systems and patient outcomes this 2022-23 flu season.
What we've noticed, and so we ought to be clear about that, is that during the SARS-CoV-2 or the COVID-19 pandemic, we saw unprecedented low rates of influenza, of other respiratory viruses like respiratory syncytial virus and parainfluenza. They all went down. And that's probably due to the fact that as COVID was being spread, we were quarantining and social distancing and mask wearing. Well, we're getting away from that now. And what we have noticed is that we keep saying we better be prepared in case it comes back to the Northern Hemisphere. Let me tell you, it has come back to the Southern Hemisphere. Australia had a very early and fairly severe season of influenza this past summer, which is their winter. So the question isn't, will influenza come back? Influenza is back, and I believe that if we saw it with a vengeance in the Southern Hemisphere, we need to be thinking about a serious season in the Northern Hemisphere. So I say that, so the best way to prevent us from getting influenza is an annual flu vaccine. And there has been an awful lot of talk now about getting your annual flu vaccine and your booster or bivalent vaccine for COVID. And so I would certainly recommend, as the CDC recommends, getting both, but it's clearly important that for influenza, you get vaccinated on an annual basis.
What about folks that have been compromised, severely compromised by COVID? They survived, but now they're dealing with long COVID. Are they much more susceptible to the flu? And should they have a different type of vaccine?
Yeah, so somebody that might have long COVID that's 30 years old, and there are people out there, and I'm certainly empathetic to that. This recommendation is an age-based recommendation. It's for those that are 65. And so it won't matter if you're 70 years old and you haven't had COVID, or you've had COVID and gotten better, or you've gotten COVID and you have long COVID. They're recommending that if you're 65 and over, you really ought to get one of these 3 preferential vaccines, one that's adjuvanted, or 2 of them that actually has a higher dose of antigen in there. So I think that they may look over time to see if people that are compromised with COVID or other chronic conditions should be using these vaccines, but 2 of them are not licensed for anyone under the age of 65. So I think the recommendation is fairly clear. 65 and above, we ought to be getting one of those 3 vaccines.
What should pharmacists be on the lookout for? What types of questions should they be asking, and other providers as well, as we approach this year's flu season?
Yeah, I think the biggest one that I keep hearing about is, should I get them at the same time or should I space them apart? And I think the data is coming in, and it's saying that there are no additional adverse events. There's no potentiation if you get them both at the same time. And in our busy lives, and I think Americans are very, very busy, but in our busy lives, it's not easy to say, I'm going to go in on a Monday and get my flu vaccine, and then I'm going to come in next Monday and get my COVID. I think it's easier to do one and done. So when you go in for one, get the other one. That's the recommendation by ACIP, that they can be co-administered. One goes in one arm and one goes in the other arm. But I think the pharmacists and I think healthcare professionals, physicians, nurses and the like, we probably ought to be saying, how do we get our immunization rates back up again, and not just saying, gee, I'll have to pick one or the other and hope that somebody shows up a little bit later. I've noticed over the last couple weeks that I'm seeing more signs and more commercials about making sure that you get vaccinated for both this year. So my big recommendation, let's follow the ACIP recommendations for all their vaccines, but they are clearly stating and new that go get your annual flu vaccine if you're 6 months and older and there's no contraindication. But if you're 65 and older, then do your very best in getting one of these 3. If one of those 3 are not available, the recommendation says, please still get an influenza vaccine. Don't say, oh, I couldn't get one of the 3, so I won't get vaccinated. Do your best to get one of the 3, but if at the end of the day, your pharmacy, your clinic, your physician only has one influenza vaccine left in their refrigerator, make sure you're the one that gets that one.
Gregg, always a pleasure, always great information. Thank you so much for joining us here and giving us this CDC update.
Thank you so much for having me.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with returning guest Dr. Gregg Sylvester. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.